My name is Debbie Fry, and I am the full-time lactation consultant here at Inspira Health in Mullica Hill. I have been a nurse at Inspira since 1994, and I've been the lactation consultant, the full-time lactation consultant for the last 15 years. I think one of the most important things and one of the things that moms are most scared of when they leave the hospital is, how do I know this is working and that I'm feeding my baby enough? I think that's one of the scariest things about breastfeeding. And I needed to come up with something that would help them, that was succinct, that would help them remember, that was easy to remember because you're so tired and exhausted and a lot of things it's hard to comprehend. An easy way to remember what's really important in knowing how your baby's getting enough. And so I came up with what I call the 5 yeses. Number 1, yes, my baby is latching well. And that is one of the most important things that I can teach you, and that we here at Inspira and the nurses here can teach you, is how to latch your baby. And what I find that's most important about it is you need to know that it's a good latch so that you know when it's not a good latch. And that becomes the most important thing, because if the baby isn't latching when you leave us, then you need more help. And I think that's a thing that a lot of mothers don't realize, that sometimes they need more help when they go home. Sometimes the 1 or 2 days here is just not enough. So the first yes is that each and every day you need to be saying, yes, my baby's latching properly. So number 2 is, yes, my baby is feeding 8 to 10 times a day. So we have a log that we give out to all of our moms who are breastfeeding, and it's a nice way for you to keep track of all the times the baby is feeding. So you will be able to look at it, circle every time the baby's feeding, and look back and say, yes, my baby has been feeding 8 to 10 times a day. If the baby is not breastfeeding 8 to 10 times a day, this is the time that you need to reach out for those supports that we'll be talking about. Either you call me, or your pediatrician, or your family practice doctor. That we also will remind you when you leave the hospital, the support systems that you need, even when you leave us, if that baby isn't feeding 8 to 10 times a day. So the third yes is that you want to say, yes, my baby is pooping and peeing a certain amount of time each day for that first week. And it changes as the week goes on because our bodies start to produce more milk. So for instance, on newborn day, the baby should be peeing and pooping at least 1 wet diaper and 1 poop. The more the merrier, but that's the minimum. The first day in life, it should be again 1 wet and 1 poop. Day 2, it's at least 2 wet diapers. Day 3, it's at least 3 wet diapers, and so on for the first week. And this becomes just another way of giving you confidence that what you're doing at home is working. So number 4 yes is, yes, my baby is content after they feed at my breast. And a lot of times contentment doesn't really come in the first couple days, which makes things hard. Babies can be kind of hungry. I use the word squirrely because they're getting small amounts of milk. But once our bodies start to produce more milk about the 3rd and 4th day, there should be a difference between before you feed the baby and after you feed the baby. Before you feed the baby starts showing you hunger cues. Maybe they're smacking their lips, moving their mouth around. We call it rooting, where they're looking around. And a late sign of hunger is crying. They start crying. And then you breastfeed them. And now after you breastfeed them, they should be content. They should be relaxed. A lot of times they fall asleep. There should basically be a difference between before you feed them and after you feed them. And a lot of times this doesn't last long because babies have small stomachs. And I think this is a really important thing to tell mothers. The contentment might only last a half hour or an hour because they need to feed again because you have still smaller amounts of milk, small little belly. But there should be a difference. They shouldn't just continue to look hungry, continue to cry. There should be periods of contentment after you feed. So you want to be able to say, yes, my baby's content after they feed. Number 5 is, yes, my breast feels softer, lighter after feeding. Especially in this first week when our bodies are just producing a lot of milk. We're very full. We're what we call engorged sometimes. And when the baby is finished feeding from your breast, it should feel different. It should feel lighter, softer, drained, whatever word you want to use. Basically saying that the baby is nursing properly and well enough that they've taken milk out of your breast. A lot of times our breasts don't feel that different the first couple days, which makes us scared, which makes us think that something's wrong. But we don't have a lot of milk yet. So that feeling doesn't feel much different in the first couple days. That's why all these other 4 yeses are important. But once we have milk, our breast should feel lighter after we're done. And that is the conclusion of the 5 yeses. And what's really important about these 5 yeses is that you should have all of them. All 5 you should be able to say yes to every day. And if you do find yourself saying no to any of these 5 yeses, that's a time you need to know who your supports are. And we are here at Inspira 6 days a week, Monday through Saturday. We give you our card with our warm line number and our email. One of the other things that we provide here in Inspira now is that we have a virtual support group that we give you the QR code. It's in the book that we give you that you can log in once a week, ask questions, and just have other mothers there to support you and answer your questions with a lactation consultant. Also, if you qualify for WIC, Women, Infant, and Children, they're a fabulous resource in our community. You can call them, they text you with you can text them with questions, they call you. You can go to their offices for one-on-one lactation support. So there's a lot of support in the community here. You just need to know how to access it, and we're here to help you do that and help you know how you can access it. And by doing all of these, I hope that you can feel really confident so that you can go home and breastfeed with confidence, and you help your baby grow and thrive, and it becomes a wonderful experience for both of you.